Around 3,000 people in the Jalan Bukit Merah area are expected to go for tuberculosis screening starting next Thursday. Well, the precautionary move comes after the Health Ministry linked 10 active cases to a previous cluster from the area, suggesting a possible spread. In mid-2022, over 200 cases were detected after similar screenings in the district. Sabrina Ng with the story.
A popular hawker centre right in the heart of Bukit Merah. This neighbourhood is home to more than 150,000 residents. But 2 years ago, some were identified as carriers of the disease. In 2022, the Health Ministry found a cluster of tuberculosis cases in Jalan Bukit Merah, Block 2. But by September last year, they also identified an additional 10 cases being linked to this cluster. Because of that, they have conducted contact tracing to identify the areas these cases visited, which concluded in November last year. The 10 cases were treated and currently do not pose any public health risks. But as a precaution, the Health Ministry will conduct large-scale screening of the neighbourhood. All residents, storeholders and workers of Blocks 1 and 3 at Jalan Bukit Merah will have to go through the screenings. Staff from both the Health Ministry and National Centre for Infectious Diseases will be going door-to-door to conduct tests for residents. Residents can also head to testing stations set up at an open-air car park nearby. Mandatory screening also extends to store owners and employees at this hawker centre. To protect elderlies who are vulnerable, those attending a senior activity centre below Block 3 also need to be tested. Those who frequent the vicinity can choose to be tested too. Screening is free and will take around 20 minutes. Testers will hand out a questionnaire and draw blood. Such preventive efforts are crucial as tuberculosis is difficult to identify at the primary care level.
To look for TB, the doctors need to have a high index of suspicion because TB is also known as the masquerader of all diseases.
Dr. Leong says the disease can lie dormant in a person's body for decades and turns into active tuberculosis if one's immune system is down. While dormant, tuberculosis is not infectious and may not show symptoms. But once the condition turns active, it becomes highly contagious.
The at-risk people who get tuberculosis after exposure will be those in the same household. Or you live with the person or you work with the person with 6 hours exposure on a daily basis, then you are deemed to have a high risk of transmission.
After the screening, those found positive for latent tuberculosis infection will undergo additional checks like chest x-rays. They will also be given preventive treatment, which will reduce their risk of developing active tuberculosis in the future. Those found with an active infection will be given treatment, and contact tracing will be carried out to identify close contacts. The government will begin engaging residents and storeholders over the next 4 days to answer any queries they may have.
It's been more than a year since the initial screening of those working and living in Jalan Bukit Merah. Life has since resumed and residents today remain unconcerned. But they are definitely more aware of the disease.
Singapore have very good hospitals, so why am I to be scared? Every disease is controllable in Singapore. Early detection is good.
No, we are not scared. Anyway, we are working here. Scared also, we have to come to work. I thought they would come to the market, ask people to go screening, but they only call for residents. So we were not called, so we didn't bother.
I checked in with several GP clinics along Block 1 Jalan Bukit Merah and was told that they did not see any recent rise in tuberculosis cases or did not provide any additional details. Typically, only a patient displaying prolonged or worsening cough will be asked to go for a chest x-ray. Only when results are confirmed will they then be referred to an infectious disease specialist or the tuberculosis control unit for further evaluation and medication. And adding to the situation, Singapore is also coming out of a recent COVID-19 wave, which adds some difficulty in identifying those with active tuberculosis, as there are overlapping symptoms. Most exposed casually are unlikely to become infected. The Health Ministry has said that tuberculosis is curable and that early detection is key to preventing its spread.